Hello, and today I am delighted to be joined by Dr. Luke Evans, who is the Shadow Minister for Primary Care and for Social Care. Luke, could you start by giving our viewers a bit more of an understanding about you and your background and also your work as a GP?
Yeah, sure. So I'm a doctor by trade, GP, exactly as you pointed out. So I went to Birmingham Medical School. I'm actually from a family of medics. So my father was a GP, mum was a nurse. My two younger brothers are both doctors. Their partners are doctors, and my wife is a GP too. So you can imagine that Christmas time is really fun around that Christmas table. I went to Birmingham in 2002, was there till 2007, did my F1 and F2 around Birmingham area. Then I took a year out anatomy demonstrating, and that's when I got interested in politics, and then went back on to train as a GP and then worked both as a salary GP and a locum GP around the area. And that's meant that I've done a lot of cover for lots of different types of care home, residential home, some practices that would just be, happen to have patients registered, others that actually had the ability to go in and contracts with the homes to be the cover there. So you do ward rounds effectively. And so that's meant that you really have seen the value of what good care staff can do and offer to you as a GP. You know, when they ring you up and say, I've seen Mary, she's not quite right, she's off her food, we've dipped her urine, there's nothing there, there's something wrong going on here, is transformative for a GP because you trust that person rather than saying, the classic one was that you get a person brought into your GP surgery, or when I was in A&E, a patient be brought in. We've got a problem, they've had a collapse. Oh, I've just come on shift, I don't know anything about the patient. Great, when they've got dementia, that's very, very hard to work out. So I think that's given me that ability to see that hands-on approach of when care can really make a difference to the patient, but also when it can go wrong as well, and what needs to change on that basis of how you try and strengthen that. And that's the big question, isn't it, that everyone's asking.
From your own experience, what would you say are the aspects of the care sector that work well and the aspects that don't work so well?
Well, I think, number one, the compassion that stands out. Most places I went to really, really cared and loved their job, which is great. Number two, when you've got the professional staff there, how much of a difference that made. I guess the wider thing, though, is for me the realisation for the public of how little they understand of what's involved in social care, and that be how to approach the system, how to enter into the system, but also the cost of the system that goes with it. And that was often the hardest part. You know, someone would bring their mother or grandfather in and say, we can't cope anymore, they're going to need support because of their dementia, and then assume that the NHS is just going to pick up the tab. And trying to explain that to people, they don't quite understand that, and that's a real shock. And then the fights that go through the system, I think, wakes people up. So that's a motivation to step into the role to try and say, how do we solve this problem? So you see really good stuff that makes a difference, but then that's the hardest part. For at the end of the day, the patients, residents and family are the key bit that is most important.
If you were to take office tomorrow, what would be your key priorities in terms of changes to primary care, but also to the social care sector?
It's a really good question. I'm going to caveat it because it slightly depends. That's a long way off. And so we don't know what's coming because there's lots of change afoot. So if you ask me number one today, what I'd like to see, I'd hope already that the conversation has changed so that the public is aware of what care should look like and what it should be. Because I believe currently in this country, we want the Scandinavian style model where the state do everything and it's Rolls Royce, but you pay the tax for it, but we're not going to pay the tax. But we also want the family commitment, a bit like the Bangladeshi, Pakistani model, but certainly, mum's not coming to live with us kind of thing. And so we're caught in the issue of what does care look like in the UK? And I don't think anyone's answered that question. So I hope that question's number one is answered. Otherwise, I'll be answering that question. The second one is then, how do we ensure that people understanding the funding arrangements and lift that blockade between people who effectively the organisations fight over the funding and whose responsibility is it? And I think the changes the Conservative government put in around integrated care boards was the right direction. The problem was that you had no teeth to enforce at those higher levels whose budget is reaching into whatever. And that seemed to be a glaring missed opportunity because everyone works collegiately until the budgets are squeezed, and then secondary care will often go, well, we're the biggest and we'll put our barrier up, and mental health will do the same, and then local authorities do the same. So I think solving that barrier would be fantastic as well.
Many people in the sector say that a core, fundamental structural problem is the clash and the conflict between budget protectionism between the health service and local authorities and the care sector. What would you do to address this problem?
Well, on that, if you think of Simon Stevens, drove this through, and he got about 85% of what the NHS wanted. So the collegiate changes to the NHS and social care that we saw in 2022, the idea was bringing ICBs together meant that everyone had a seat, everyone had a role. The problem was there was no teeth to make people accountable for, and how they set themselves up and who was in place was a question mark, because it was up to the individuals, which is great. But if you then don't get a representation from social care, well, how do you get that heard? And who does have the final decision when it comes to it not becoming collegiate? So in that system, I think it needed more teeth. The problem is the new government is changing that system, because ICB's roles are now changing to just commissioners. We've got NHS England being abolished, and so this is going to the Department of Health. So we don't even know yet what social care looks like within the structure of that. Plus, on top of that, you're doing local government reorganisation. So we don't even know at that level what's going to happen to social care, where the responsibility lies. So all of these things are moving and trying to tessellate, but the government's given no steer on which way things should be ordered. And I think that's a really, really worrying position to be in, because the NHS is now looking internally. You've got local authorities all looking internally. We're now bringing in things like police forces as well, who are now going to change. You're moving all these plates at the same time. So I can't answer your question, because I don't know what the landscape is going to look like in 2 years' time to even know what we should say should change on that basis, because I don't even know. I've got a 2-tier authority in my area. Is that going to be a unitary? If so, which way is it going? We've got the NHS looking from Leicestershire, so I represent in Leicestershire, joining up with Northamptonshire. Yeah, we've got the area trying to decide itself. Are we going to have a city? Are we going to have a big donut? Are we going to have two authorities that are split? So I can't even tell you what the answers to those are. The next 2 years are going to be very, very turbulent, all while Casey review is ongoing to say, well, what does social care look like? So here lies the dilemma for me from where I'm sat. To answer your question, what would I change? I don't know, because I don't know what the fundamental pivot point is. What is the question we're trying to solve here? And until you solve that question and know, it becomes very difficult, because every other moving part has a knock-on impact, and we don't know who's settling where.
Many in the sector feel that the Casey Commission will publish its findings too late, and that there won't be enough time for the government to take any meaningful action to address its findings. What do you say to that?
Well, I think you're right on that. And if we do the practicalities and the politics of it, the practicalities of we're delaying the decisions even further, and I've just talked about all the reorganisations that are going on when there are solutions out there, which had broad kind of agreement. They all have pros and cons, but there at least was some broad agreement on where you could go from it. You've got the review itself went from being a cross-party talks to an independent commission. You've got Casey split across 3 commissions now. She's doing the looking into rape gangs. She's also seconded to the Home Office as well, but on efficiencies as well, and trying to do care. Now, she's a brilliant woman, but she's a busy woman. There must be other people who can take that on. So again, is social care falling behind on that concern? So that's the practicalities of it. And you're right, we're going to get the interim report supposedly in 2028. That's going to be a year before an election. That makes it very hot. So I worry it will become a deal not Mark 2. That there may be solutions, but no one's going to pick it up. And then you've got the recommendations finally closing in 2036, so a decade away. Now, I'm pragmatic. You're going to need some time to change the sector, but also that seems a long way off. And then you've got the politics of it, of exactly that. I worry that we're going to end up having a football. Now, the Conservatives in the last election did have a commitment in their manifesto specifically to try and deal with this. It didn't get picked up, we didn't get voted in, and there's always a risk when you do that. And we've also been burnt before from the Conservative point of view when 2017 we brought forward a manifesto change, and the public weren't ready for that, the politicians weren't ready for that, and sensible conversation to be had, but not done in the right way, and the whole thing fell apart from it. So political parties, unfortunately, in this country are burnt about stepping forward to deal with this, but even more so, that's why it's even more important you do deal with it to be able to solve the problem.
What do you think needs to be done to prevent the care sector being used as a political football, or as some have said, being weaponised? What do you think needs to change to have a cultural mindset among politicians to stop this short-term thinking from happening?
Step back. Every developed country is struggling with this same issue of how you deal with an aging population with more comorbidities when you've got technology and medicine advancing at such a fast rate. So there's always going to be a rub there. But within the UK, I think it goes back to fundamentals. Is what is care? What is the purpose? And what do we as Brits want our care to look like? Do we want to have more people coming home? Do we want to have the state step in more? At what point do we say to people, you want to be downsizing? So if you compare us to places like Australia, New Zealand, Canada, many people will choose to move into retirement villages and downsize. That doesn't happen very much in the UK. I mean, I think it's about a quarter of people in those countries think about it. We're down about 7% of people. Now, it's partly because we don't have them, so the planning system needs to change, but also culturally, people want to be in their homes. That's where they've spent their life. It's inherent in British psyche to own your own house. That's where people mainly want to be. So how do we change that? How do we unpick that? These are big, big questions that need to change for us to be able to deal with the question of then what does the system look like? And I align it to, we're starting to have finally conversations about what death looks like. It's coming to us all. Assisted dying has meant that the country is now thinking about what may well happen. They're missing that 10 years, that last 10, 15 years of how do we want to spend our life if we are more infirm, if one of our partners becomes infirm, what does that look like? And until we, as Brits, have an understanding of what that looks like, it's going to be very, very hard to say, well, how do you fund it? And also pooling that risk. That's the other thing, isn't it? Because you may save up for that event and you have your heart attack at 75, or you may end up frittering it all away and being demented for 15 years. And that's how do you pool that risk is really, really important as well from us as a society, but make sure it's fair to everyone.
Do you think that we're likely to see the public shift their attitudes towards adult social care and many of the preconceptions that still exist today?
Well, here's into the funding part, and I think you're right, because this is when it becomes a little bit of a canary in the mine, because you're starting to hear that. You hear, unfortunately, care stories, you hear of people being stuck in hospitals, and we know the best way you see this is we know on average about 15 to 30% of beds are people who are fit for discharge who can't get social care. So therefore, you inadvertently see the outcome of what's happening. Then you're getting local authorities saying, we've got a statutory duty to deliver our care. We already spend 70, 80% of our budget on social care. How do we deliver that? Because we're going to either have to put up taxes or make cuts. So these are things that people are going, well, why is that happening? Our job as a politician, and particularly as opposition, is to highlight, well, this is the stressor that's on your county council elections, that's going to be in your Scotland elections or your Welsh elections, to see where it comes in. The problem is, in terms of order, it doesn't always get the traction that it needs. But for me, this problem, unfortunately, is only going to get worse while it's in this situation. So therefore, there's going to be more chances and opportunity to talk about it. And as more and more people see the baby boomers move into this generation of suddenly needing their care, it's their sons and daughters be raising this, going to their MPs, saying to people, hang on a second, what is going on here? And you'll see it through the front door of the NHS. So I think there's a juxtaposition that will actually show it. It's how you coherently say, well, part of the problem is because if you're someone who's fit to go, but they can't afford to go in the care home, they're not safe to go home, and you don't want them to come into your house, how are we going to square that circle? Most families have been through that or know someone who's going through that. And I think it's there, it's just being taught, getting it talked about.
When will the silent crisis affecting the care sector become a national emergency?
As in what's going to drive it to be on the front of the agenda. This is the hardest part, and I think that's my worry about it, because it's sort of almost an acceptance about it. I think the biggest two drivers that will help are, number one, seeing the pressure on NHS and A&Es, because actually the conversation does go, well, why is there so much pressure? Why are there queues? And that's because there's a stock. The assisted dying, I think, does a lot of heavy lifting in this space, because if you can shoehorn the two together and say, well, actually people are thinking about where they want to die and how they're going to die, they've got their 5-10 years in the run up to that. How do we put provision in? So there is a clause in the bill that was nodded through that there has to be a government report on the financing around palliative care. So if you're into palliative care, a lot of social care comes into palliative care, which is really important. So you're already starting to widen the argument and the debate about it. But I think as people go on and realise it, as the Casey Commission is going to have to report, that will be the chance for people to have conversations about it. But I don't see I hope I don't see something going bust and something going bang and suddenly people waking up to it. The pips are squeaking with the local government though, and I think that will make people think, because that's what people are, that's another way that people will see the outcome because of the costs on that pace. And different parties, Reform, Labour, Conservatives, Lib Dems, all making choices when they're running the councils is going to highlight that.
Many in the care sector say that the recent tax increases affecting it are, in essence, the Treasury's way of gambling with care providers. Do you think that the Treasury's recent moves, led by Rachel Reeves and her budget to increase taxes that are affecting the care sector, are putting care providers at risk?
I think if you step it back, I can't work out from this government, especially when it comes to health and social care, is whether they knew what they were doing with the Treasury when they raised these taxes and then said, well, we're getting more money in total for it, so therefore we know we're going to tax hospices, tax GPs, tax care homes, and they'll just have to suck it up. Or actually they saw the highlight of getting 26 billion or what it is and just said, oh, we're not aware, we don't know the small print and the detail behind it, and actually, oh my God, now we're having to deal with it. And I swing, depending on which day, and what I hear is you have to look at the business rates only affecting pubs. Now, we've put these in, increased the business rates, and now pubs are getting a bailout, but cafes, restaurants, these kind of things aren't. And you go, well, if you knew that information before, which they definitely said they did, why are you still going ahead with it? Same applies here with care homes and hospices. And I do worry as well. I think it's most acutely felt in the hospice sector, then the care homes, then the GPs. And already you're seeing hospices, we've seen some close, we're seeing some really getting into financial difficulty from there. That's why I think, to be fair to the Liberal Democrats on our side, we wanted to amend it to cut, to make sure there was a cut out and a carve out for the likes of care homes on that basis. So I do worry whether Treasury are willfully. It's hard to know because we haven't been given the information in front up, and when you try and ask those questions to say what's the impact assessment that's going to be coming out with this specific to the sectors, you don't get any answers. So I don't know whether it's been willful ignorance or just Machiavellian say cut, yes, they can suck it up. And I don't know is the honest answer. And that's a question I'd love to get answered, because at least it gives clarity, because the worry is that people are out there thinking there's a Machiavellian plan to do this, or you should be clear and upfront and say this is why we've done it and we think you can handle it and this is the way we're going to shift the system to help.
What are the biggest challenges that you face in your role as a shadow minister?
I think getting information out of the government, number one, to then base your decision making on or ask those questions. And if you're not getting clarity, Sky did a report saying that the number of written questions has gone up astronomically, and putting it, their suggestion was because people are using AI. I would say certainly in my office, I put in name day questions which come back with holding answers, and it would be as simple as, can you tell me how many times you've met the leader of the pharmacists? That's someone looking at a diary, you should be able to answer that very quickly. So there's an aggravating factor that you're not getting the answers you need to come out. Wider still though, in answer to your question, yes, it is hard. I see ourselves in opposition as one hand developing our policy for the long term, but the other hand is we are the spotlight, and the chance, the great accolade I have and responsibility is to shine a spotlight on different areas and try and raise them up. Ian Duncan Smith, because I sat him down after I'd been made a shadow minister, and said, look, you've done opposition, how do you deal with it? And he said, the government needs to know everything at all points in time. You need to be specialist in the areas of focus. And it's a bit like being a flea on a dog. Keep biting and biting and biting that dog, and eventually it will move. And I think that's what you're seeing from us as His Majesty's opposition, be it the Chagos deal, be it winter fuel payments, be it farming tax, be it business rates, asking these questions, punching the bruise, making sure that people really understand, are you sure you want to do this? And then getting the resulting change out of it. So that's the bit that I enjoy, but it is difficult because it's easy to do opposition. It's a bit like being a GP. it's relatively easy to be an okay GP. It's actually very hard to be a very good GP because you need to know everything all the time and do a lot of detail. So that's the bit that I'm enjoying wrestling with, spending the time getting to know all the ins and outs, and spending a lot of time just listening to the sector, what the problems they are, and reflecting them up to government. I'm very clear and honest with people when I meet them. Say, I want you to be able to talk to me, ask questions. I may agree with you, I may disagree with you, or I may say, I don't know, all are fine, but I hope I can be able to be upfront with you and say, explain my position of why I'm doing something or why I won't do something. You understand it, you may disagree, but you should never be unclear about what's going on. Full circle, I'm unclear about what the decisions are being made, be it across primary care or social care, and that's my concern.
Can you tell our viewers a bit more about your role? At this stage in the election cycle, is it harder to get the face time that you need with key decision makers that are influencing the care sector?
Oh, no, fantastic. I say the opposite. People are very, very keen to come and speak to us and approach us and be heard, which is lovely, and be listened to from that side. I think they understand there's an opportunity. Being slightly political now, I think I've definitely... There is a feeling that in the run-up to the election, a lot of the sector was heard loud and clear and had got a lot of airtime. Since the election, trying to get heard and get your opinions in has been much more difficult. And so that's been quite interesting as an opposition, because it means people want to talk to me because someone is listening and asking questions and talking to people. And so this, it's an open opportunity for me to have conversations with people and just understand what's really going on, because everyone wants solutions, wants to know a direction. Take the NHS 10-year plan. I think whether you're Reform, you're Green, whatever part of the sector, and you all agree with the principles of where it's going, the big difficulty is missing the delivery chapter. And without a delivery chapter, people go, this is great, but how are you going to do it? Same applies to social care. They're just one step behind. They don't even have a plan of what you're trying to aim for to then have a delivery plan of how you're going to get there. So I hope Casey Review comes out with something like that, because at least then we can have a conversation of where we get to. Otherwise, you're in the dark, and it feels like it's playing second fiddle to the NHS at the moment, and actually has such a big impact on the NHS. So you do need to have them both together, talking to each other more clearly to make a big difference.
The question on everybody's lips is, what opportunities and challenges do you think AI poses for the care sector?
Well, in my 6 years of being in Parliament, it's a jump to technology will solve all the healthcare and social care problems, but without explaining why. And usually they turn around and say it's something to do with the patient having this or wearing that. If I backtrack a little bit, though, one of my biggest bugbears in the NHS has been the use of technology. Because if I asked you today I want you to book a round the world trip, go to 10 countries, book 10 hotels and the flights to go with it, you'd probably spend an hour and you could do it all on your phone. If I asked you tomorrow to cancel it, you'd be able to do it all and get the money back just like that. Yet when I used to go into a GP surgery, it would take 10 minutes for the computer to even load up. And so 7 GPs would stand and have a coffee. It was quite a nice morning experience, but that's crazy. You know, when I get an NHS appointment through on my phone, because I've had neck surgery, I can't cancel it. And you think that this is barking mad. So if you can get the technology working as it does as well as your phone, in the simplicity for those who work in the care sector and primary care, already you're onto a winner, because they're happier, they're more efficient, and that's better for patient outcomes. Then you widen it into what patients can do, and yet that kind of monitoring, be able to feed in data, is going to be hugely important, especially for those who are vulnerable. That would be really helpful if there's movement pickups or medication reminders. We have systems looking for polypharmacy issues as to why someone is collapsing or falling over. Why can't we see where spare capacity is across the system at any one point? A live reporting of beds in care homes, so that you could get a discharge straight out of hospital to say, well, we already know this bed is coming up free, and there's no reason why the system can't do that if it's already set up, but they don't talk to each other, let alone talk across boundaries. So I'm on Leicestershire and Coventry and Warwick. There's a chance there to incorporate that notes. My wife will get blood tests from one and she can't look at on the other. This is 2026. It's crazy. So going into a care home and being able to see as an out of hours doctor what the notes are, what someone's previously said in a surgery, seems completely sensible. We're very slow to pick that up. So these kind of things are where people talk about technology. I'd like to see it make a difference, because I think that streamlining those simple systems could actually make the job much more rewarding, much more efficient, and better for patients. Well, if I had to use the A&E example again, the number of times that someone from a care home gets sent into A&E now, we could have the argument of whether they should get there in the first place, but let's say they do need to go there. It's often the most junior member of staff sent with them because the other member of staff need to be looking after, they're under pressure in the care home. So when the doctor's assessing, they don't have access to any of the notes, what's going on, what's been happening, what's the normal state of play. With someone with dementia, the carer's just come on as the new shift, not knowing any of that information. That's a lot of work then of phone calls, understanding, which could easily be dealt with by technology if you can quickly share the information that's there, either through primary care in the GP system or through what's recorded in the care home, to answer those questions and make that difference. Does this patient have a DNA, or who is there, the next of kin that goes with it? Good care homes, and this is where we circle back, good care homes will send you that information, have packs that go with it. Unfortunately, sometimes that doesn't happen, and that's when the inefficiencies in the system go, well, hang on a second, can't this computer systems nowadays, this day and age, look at this?
One notable proposal put forward to address the funding challenges between the health service on the one hand and local authorities on the other is to strip away funding from local authorities and centralise it. What do you think about that idea as a proposal?
I don't know, because I can see benefits in what it's trying to solve, but the risks of having centralised NHS funding is part of the problem that people are concerned about. And if you look at the modelling in the NHS, we're trying to push funding down back into localities for local people in local places to make local decisions about what's best for them locally. Suddenly, if you're going to reverse it and invert it, I think you're into a real problem there. So you may have solved one solution but created another one without that accountability. So without seeing an evidence base to make a decision, I don't know. But wider still, I think it's worth considering. The pandemic taught us that actually when necessity is there, we can actually get things done and change the system very, very quickly. That didn't need government intervention. That needed the leaders to say, this is our priority, a very clear priority, and this is how we're going to achieve it. Somehow we've lost that again, and that was a driving force for me getting into politics in the first place. Being in the NHS, being told, you're too junior, or we've always done it like this. And actually, I think lots of people do lots of good work, but they don't feel they have the ability to change the system. So they're a slave to the system rather than having the ability to become master of their own destiny. Let people make those decisions better for them, and they'll create better outcomes. But the problem is you're always asking for permission, not for forgiveness. And there's a risk aversion element to this, which is important because it's patient care, but also it means that no one has the ability or resources to actually demand that something changes. And I think I'd like to see that be a key driver.